Hello, everyone, and welcome to Introduction to Holistic Nursing with the Holistic Nurse Academy. I'm Holly Taylor. I am the owner and founder of the Holistic Nurse Academy. I am a registered nurse and have been for about 15 years. And I'm also a board certified holistic nurse. And that is the impetus for the Holistic Nurse Academy and why it's here. I also have with me my good friend and colleague, Elizabeth Monson, nurse practitioner with lots of other credentials behind her name, and I'll let her tell you all about that. Go ahead, Liz.
Hi, thanks, Holly. My name is Liz Monson, and I am one of the faculty with the Holistic Nurse Academy, and excited to be here, excited to be working with Holly. Just my background, I have 27 years working as a nurse practitioner, mostly in cardiology, but my passion, my love is integrative medicine, and I have been working with that for 20 years. I am a clinical acupressure therapist, which you'll learn more about in just a moment, Reiki master, and also trained to teach yoga. And I've been involved in setting up some inpatient healing arts programs in Maryland, Oregon, and starting to in Utah as well. Love integrative medicine, love to use it with my patients, and love to train nurses on how to use these techniques at the bedside or clinic or whatever environment they may find themselves in. So I'm real excited to be here today.
Yes. Thank you for that introduction, because it reminded me, also, we are both very passionate about this. That's why we're both here. I forgot to share my passion, but also I have been in home health, hospice, geriatrics for the most part of my nursing career. So thank you for that reminder. We are just going to jump into it. We know your time's valuable and that you're here for a reason, and that you seem to have an interest in holistic nursing. What is it? And is it something you're interested in and would like to learn more about? That is why we created this introductory course, hopefully just a way to bring to you some quick information that allows you to make a decision if this is something you're interested in or not. So just to start with the outline, we're just going to go over some holistic nursing principles. What is it? And define it, and a little bit more about holistic nursing. We're going to talk about healing presence and its importance to this practice, and why we feel pretty passionate about that. We're going to talk about the energy anatomy and holistic therapies, including meditation, breathing, mind and body therapies, and touch therapies. We're just touching on some of the topics that you can get involved in with holistic nursing. These are the ones that we feel that we're most equipped to talk about in this presentation. And then at the end, we'll talk about what our Holistic Nurse Academy offers, how you can get on board and start taking classes. So, all right, so let's just talk about the Nurse Academy, the Holistic Nurse Academy, for a minute. I started this journey 10 years ago, just by chance, and was led to alternative and integrative is a better word for me, modalities. And I will tell you what it did for me is it helped me connect to my love for nursing and the roots of nursing. It reminded me, oh yeah, this is why I got into this job. This is why I chose this as a profession. So we here are really passionate about helping other nurses connect to your roots and why you became a nurse and healing. And the purpose is and number one, to help you connect to your own healing. So number one, this is about you and what you need right now and how this can help you and your family and your environment. And then, hopefully that will allow you to reconnect with your love for nursing because you're taking care of yourself, you're doing your own work. And then through that will empower you to use these tools in your practice which will give you this sense of like, okay, I can do something in the here and now for my patient, for my client that feels productive, that feels like I made a difference. And that also just has this deep connection, like being able to show up for somebody in that way is just really powerful. And we know that you're already doing it on some level. You're a nurse, that's what you do, but this is just to take it to another level, and we'll show you the path. We also really want to build up the community of holistic nurses. So I love the people I've met, including Liz and other nurses who are just as passionate about as I am, but just supporting each other and realizing this is a tough profession, and it comes with a lot of emotional, spiritual, I don't want to say, burnout is part of that, but it just comes with a lot of emotional, spiritual strain. And this is a community that you can lean on as you're navigating that. Liz, do you have anything to say about that before we move on?
Yes, I have been doing this for a long time, training nurses, and I really do emphasize that this is the roots of healing. This is the roots of medicine. If we go back and we look at traditional medicine systems that have been in existence for thousands of years, a lot of these techniques are employed. A lot of them are non-pharmacologic, and it is so powerful how they are restoring, not only to you, but in your connection to your patients as you utilize them. So it is this remembering of this roots and connecting back into it. And it's extremely wonderful and satisfying to be able to offer these, not only to ourselves, but to others as well. So we're excited to share them with you.
Thanks, Liz. All right, well, let's just start off by defining what a holistic nurse is. The word holistic can trigger a lot of different thoughts or beliefs or definitions. So for all intents and purposes of what we're trying to do, we will try and define it as the Holistic Nurse Association defines it, and how we here define it. So bear with us as we do that. A holistic nurse acknowledges physical, emotional, mental, and spiritual self and others. A holistic nurse engages in healing-based relationships and care, strives to create a healing environment, recognizes that healing can take place in the absence of a cure, embraces and integrates Eastern and Western medicine philosophies, is an option giver, and participates in an active self-care program. So I have a feeling that the first three are pretty intuitive and innate already for you. A couple of things I want to touch on is, let me go to the Eastern and Western philosophy. We really want to create a balanced approach to wellness and how people view their health. So we believe in finding that middle ground, being very grounded about it, and welcoming all aspects of healthcare from Eastern to Western medicine. It's really important, and I think we want to build bridges, and we want everyone to feel included. And because we do that, that does allow us to become an option giver, where we say, you can do this, or you can do that, or you can go down this road, or this is an option. People are very unique, and there's lots of ways to live, and there's lots of ways to make decisions. And, I used to think that as a nurse, I had to have all the answers, and I was the one with the answers because I had this, knowledge that I earned. And, but being an option giver takes so much weight off of you. It really allows you to be what we're going to talk about in a minute, present, and not feel that weight of like, I have to have all the answers, but isn't it great that I have a lot of options you can choose from? So, and then the participates in an active self-care program. If you're laughing at that, we understand what's self-care when you're taking care of other people. We hope to change your mind about active self-care program. and realize that you are the priority. You can't give from an empty well. You've heard that before, but it's really true. It leads to burnout. It leads to feeling overwhelmed. It leads to not being able to show up for people. So it's really important that you have an active self-care program because we need you and we want you in the field and with us for as long as possible. And, you know, and I say we need you in a kind, loving way, not in a way that puts more pressure on you. Liz, do you have anything you want to add?
As you were talking, I was just reflecting back about 20 years ago, and I was in Maryland. We were starting a program there, and how the environment was at that time. And it was the thought that if you did, these integrative therapies, you could do one or the other, or you could do a Western based healing plan, but you couldn't do both. And it was just one of the biggest fallacies. I think I probably did more education on that like, no, we're not disregarding all of our Western randomized control studies.
Yeah.
We're adding something to this, and we're adding something that really takes into account the whole person. It's not just the physical disease, it's the emotional response, it's the thoughts and beliefs and about a person in that setting, and the meaning that it imparts to them. And I'm very grateful that I think there's a newer generation of healthcare providers that are understanding of this. Sometimes it still requires a little bit of education, but this is really bringing the wisdom from the past into the cutting edge technology of the future. And they both work beautifully together. So
Yes. We feel very strongly about that here. And that's something we will continue to emphasize. So love that example. All right. So let's just talk about the holistic nurse role. This is straight from the Holistic Nursing Handbook. And it says holistic nurses integrate complementary alternative modalities into clinical practice to treat people's physiological, psychological, and spiritual needs. Doing so does not negate the validity of conventional medical therapies, but serves to enrich the scope of nursing practice and to help individuals access their greatest healing potential. Holistic nurses focus on care interventions that promote healing, peace, comfort, and a subjective sense of well-being for the patient. All right. So one of our goals here with the Academy is to create awareness of this process called or becoming board certified as a holistic nurse. I wish more nurses knew about it. And so part of our focus and our goal is to help more people realize it is an option. You don't have to do it, but it, for me, it really did change my practice as a nurse. And it really showed me how to bring the modalities I was learning about into my nursing practice. For a long time, I was taking classes on the side as a hobby, thought it was cool, thought it was something interesting for me in my world. But at some point I was like, there's got to be a place for this in nursing. And this specific process really helped me to integrate it. If you're like that, like me, and you've also been taking classes and you're also interested in this and you don't know how to integrate it, this is one way to do it. It also gives you a little bit more, depending on the state you're in, licensure to practice as a nurse in different ways. That kind of opens up new doors for you. So just so you know the certification process, we just want to give you some awareness around it. There's a website at the end of this slide that will, it's worth exploring if you're interested in this. But here are the requirements. You have to have an unrestricted license as an RN in the US, 2,000 hours or 1 year full-time as a holistic nurse, and practicing within the last 5 years. And then 48 hours of CNE in holistic nursing theory, research practice, or related to topics within the last 2 years of applying. So part of our goal and mission is to provide for you those 48 hours. If this is something you're interested in obtaining and achieving, our CNE hours do go towards this certification process, which is, to put it, I'll try and sum it up real quick, but for me, it was a very long and winding process. We're trying to simplify that whole process for you so you spend less time trying to figure it out and more time on what matters so you can just get it done. And then you have to have graduated from a nationally accredited nursing program. And for further information and more details on that, there's the website right there at the bottom bullet. If you have any interest in it, I say it's really worth it. You do have to maintain your certification and you're recertify every 5 years. And I really enjoy learning and the process of becoming board certified. So if you have questions about that, please reach out to us, at any time, but also if you take one of our classes, feel free to ask us about that as well. So let's just take a moment to talk about Healing Presence. And just in case you're wondering, Liz and I did split this presentation up. She's going to speak in the second half a little bit more and then I'll kind of take the back seat. So she will be sharing her part of the presentation. All right, Healing Presence. Just a quick definition. Healing Presence is a constellation of personal qualities, relational skills, and professional behaviors that can have a transformational influence on individuals, groups, and communities. Healing Presence is an antecedent.
Antecedent.
Thank you. I wasn't prepared for that one. To physical health and healthcare interventions. It transcends technical skill and supports the innate wholeness of individuals and their capacity to heal themselves. The qualities, skills, and behaviors that make up Healing Presence can be intentionally cultivated through specific practices. The thing I want, the definition is nice, but the thing I want to emphasize is that Healing Presence is a skill. It's a skill we learn. It's not something we're all gifted with and know how to do it for various reasons, from the way we were raised to just life and life skills. So this to me is a life skill. It's a nursing skill that you do have to practice after you learn. Liz, do you have anything to say about that?
I think this next slide illustrates this really wonderfully. So this is, before you learn any skills, this Healing Presence is just really how you're approaching life, how you approach challenges, how you approach people, how you approach situations. And this is one of the ways, philosophical views from a Dr. Rachel Naomi Remen. It talked about how we approach life. And if you look at this graphic, I'll just read her quote. She says, helping and fixing and serving represent 3 different ways of seeing life. When you help, you see life as weak. When you fix, you see life as broken. When you serve, you see life as whole. Fixing and helping may be the work of the ego, and service the work of the soul. And just to expound upon this, when you approach a situation, you're like, oh, I'm going to fix this. You're that's the ultimate ego. That's like the power. I'm going to make this whole again. It's kind of this striving. It's not honoring, an individual's worth or integrity. And helping, it's like you show up, but you see someone as maybe they need your help. There's this unequal hierarchy of, again, putting yourself above a person that may need your help. Service, you come to the table as equals, and you don't see life as broken or helping, that you're there to serve and you're there to show up and to be of service. And again, as Holly said, this takes practice, but this for me is really just about becoming that Healing Presence, is being there to serve, being there to address whatever needs to be addressed or offer whatever needs to be offered in the spirit of service.
Yes. Great. Thank you for helping with that. Because like I was saying, previously, I came into nursing thinking, okay, I have this knowledge and now I was in that fix it mode, or I have to have the answers. And as I've grown and matured and as I've learned these skills, it has expanded. Like, I like that this visual is like an expanded visual, because that's what it feels like. The more expansive you get, the more, you get to that service area where you start looking at it as the work of the soul and just showing up with your presence and realizing this isn't about fixing anything. It's about what you can do by showing up for somebody in your, most present self.
Mm-hmm.
So what does it mean to have a healing presence? I found this quote and I really liked it. It's also from someone who practiced cranial sacral therapy, which is also what I do. So it's fitting that this person quoted is a cranial sacral therapist. But it is the capacity to hold a healing space for another with your calm and centered state of being. Another way to put it is recognition that healing can take place in the absence of a cure. And not that a cure isn't a worthy cause, but it kind of goes back to that fixing. And if you feel like if you don't fix it, then you failed somehow, this will be a very hard career path and life. Where if you can find some peace and like, I made a difference and I connected with someone in a meaningful way by showing up, is a much different, more sustainable way to make it. So one of my favorite examples that I've come across of this healing presence comes through this Dr. Jill Bolte Taylor. She's a neuroanatomist, and she wrote a book called My Stroke of Insight. If you get a chance, please read it. It's really fascinating, insightful. She suffered a major stroke, and it really took her a full 8 years to fully recover. But she, once she did, she was able to articulate how important it was for how people showed up. And I'll let her tell the story we're going to watch a small video clip. You can find this on YouTube, but we'll go ahead and play it here. And I'll let her tell the story of the importance presence had in her healing journey.
Jill Bolte Taylor was a brain scientist at Harvard University. She suffered a stroke back in 1996 as she was getting ready for work.
When the hemorrhage happened, the left hemisphere got wiped out in its functions, but the right hemisphere was okay. The right hemisphere is right here, right now, and it's being, having an experience. The right hemisphere thinks in pictures. The left hemisphere thinks in language. Our left hemisphere is about the past and about the future, and it has a to-do list and is doing. So the two hemispheres just think differently. So when I lost the left hemisphere, I lost my past and I lost my future. I lost my language. I lost the identity of whom I had been and all the memories of my life. I was still capable of being in the present moment. I just was no longer connected to the portion of my brain that said, I am an individual, this is my name, this is the data of my life, and this is what I need to do in order to get help.
After a few days in the hospital, Jill's mother came to help care for her.
Everybody was excited. My colleagues were there. Gigi was coming to town. Gigi's coming to town. I'm thinking, what's a Gigi? What's a Gigi? I didn't even know what a mother was, much less who my mother was. And everybody's all excited about Gigi coming to town. So Gigi arrives, and I'll always remember this moment. I'm in bed, and Gigi peeps in around the corner of the room. She walks past the doctors, she nods to them, she greets my colleagues, she walks around the bed, she picks up the sheet, and she crawls in bed with me. She wraps her arms around me, and she starts rocking me. And I'm thinking, oh,
Remember this?
that's what a GG.
crying.
This is what a GG is. That's nice.
No, that's the most
That's
beautiful moment
nice.
you read.
It was so beautiful. She's all about me. She's tending to them, but she's about me. This is about me.
So this was the thing that changed me, that I realized that a lot of time, one of the things you said in the book is that I'm in here, come get me.
I'm in here, come
I'm
find
in
me.
here, come find me.
Come find me.
And many times when people, just because they can't speak or they can't communicate,
Right.
or the side of their face is dropped,
Right.
they're in there.
That's right.
Come find me. And what you were more perceptive than you've ever been in your life,
Totally.
because you could feel the energy that everybody brought you and
That's
it
absolutely
brought to
right.
you. And one of the things you said that really changed me was, I wanted people to be responsible for the energy they brought to me.
That's right. Take
Yeah.
responsibility for the energy you
that they
bring.
brought to me. Yeah.
Yes, absolutely. Because that's all I could perceive. I was in the present moment, and that's all I could perceive. And if I had a doctor come in and just kind of talk to my mother or talk to my friends or just go about without me, not even bother to make eye contact or try to connect to me and show me that they value me and that they value the connection, then I'm not going to show up.
Right.
So I needed that.
We all need that. That's just one of the greatest life lessons I've ever heard. Take responsibility for the energy that you bring. And I
see if I can. All right. So there's some other things that you can research on YouTube if you want to learn more about her, but such a fascinating story, such a powerful demonstration of why healing presence is so important. So here's her quote: take responsibility for the energy you bring. And I just wanted to talk about that because, that can feel a little loaded. What does that mean? The energy I bring. And, I really could talk about this part for the full hour. We're going to be here, but I'm not going to. But when I've tried to dissect this so it's more tangible for us, it does start with little things like, am I making eye contact? She mentioned that, are you connecting? Are you even, one of the things I've learned is like how important eye level is. So just sitting in a chair or somewhere, sometimes I kneel so that I'm eye level with my patient. Are you projecting some warmth? Are you projecting like that I'm approachable, that I care? These little mannerisms that say, I'm with you at this moment. And I know like nurses have so many tasks on their plate, and we have become such great taskmasters, and that's the product of the environment we're in. And I feel like it's getting worse, and I don't like that at all. And I've really had to work within my own nursing practice to work on my presence, to take a breath, so that when I go into my patient's room, I'm with them. I'm not thinking about all the other tasks I have to perform after. I've spoken with some people, even recently. I hear this kind of a story a lot where they say, where they do praise, they do say the nurses were great, the nurses were wonderful. But there have been times where people will say, do you know that not one person laid hands on my wife who was, in the hospital with cancer? Not one person made eye contact because they were so busy doing the task. They were typing on the computer, they were hanging the IV, and then they had to get on to the next thing that they just felt dismissed or not important. And, I took some time to say, do you know why we're kind of that way? And I have explained, but what I would love is for us to start taking more responsibility for that energy we bring, because honestly, what I have found is that that's everything to a patient. More so than what we can do is how we show up and that we're making eye contact and that we care. Do you want to add anything before I move on that list?
Yeah, I learned this lesson fairly early in my nursing career. There was one time I was working with traumatic brain injuries, and I was a very young nurse, and I came in and I had actually just heard some upsetting news. And, it was at work. I had to go back to my shift. I could feel it inside of me, vibrating, but I needed to go and do what I was assigned to do. And I went into this room of this young man, and he all of a sudden became very violent, and to the point where I need to excuse myself from the room, get some additional help in there. And I came back the next day. I kind of worked through this news that I had received, and completely different experience. I had this young man again. And it was then I realized that, yeah, I had something in me that was not resolved. And when I went in, this traumatic brain injury patient could feel it, and they were responding to that. So, this is very, very powerful. How we come in, and I think it underscores the need for, working, self-care, so that we can be present with people in meaningful connections in this way.
Yes, it's definitely something I wish I would have understood a lot earlier in my career, because it's changed everything for me as I've learned this skill, and it really has been a learning process for me. So thank you for sharing that. That's a really powerful example.
Learning process for all of us.
So,
Every day is a learning process.
yeah, it really, sorry, before we move on, it really has changed how I work with my clients, how I work with my patients, that it has brought a lot more meaning to the work, for sure. So, all right, let's get into more of Liz's side of the presentation, and she's going to start with energy anatomy.
Very good. Thanks so much. So we're going to talk a little bit about the energy of the body. So we know systems of the body: circulatory, pulmonary, nervous system. Think of energy system as the system that encompasses all other systems. So we're going to be looking at it through three different lenses that, again, expand out. We'll be dealing with chakras, or the energy centers of the body. We'll be talking about meridians, which are the lines of energy that move through the body. And then we'll talk about the energy levels outside of the body, called koshas or aura. So I'll just have you flip to the next slide, Holly. So some of you may be familiar with this. If not, this might be a new concept. But when we form embryologically, the very first structure is that spinal cord and the brain. And the nerve roots to our entire body lie along that spinal cord and that brain. What we found is, I should say, civilization, we now have tools to measure these fields, that we have these really high potency energy centers, neurological centers, that line up through the spine and the brain. And if you can look at this diagram, it starts at our tailbone, basically, and goes up through just above our head. And these centers are associated with colors, they're associated with sound, they're associated with elements, natural elements. They have affirmations that you can see right here. And they all represent different aspects of our life. So sometimes we'll say, someone's blocked in the root chakra. There may be an issue with feeling secure, feeling safe, feeling like they belong to a group or family. Those are issues that tend to center around the root chakra. We go up to the sacral chakra, that's just right above that root. Has to do with creativity, sexuality. This is where the reproductive organs are located. So a lot about relationships and our relationships with other things like money. And control, that can all be in the second or sacral chakra. The third chakra, the solar plexus, this is kind of where I am, where our individuality, also where our self-esteem and any gut issues or gut instinct are located here. Coming up into the heart, this is the center of love, forgiveness, compassion. The throat is about expression, about will, about trusting. The third eye is opening up the intellect, imagination, intuition, seeing that big picture. And that crown chakra is opening to, it's about letting go. It's also opening to higher consciousness in whatever form that consciousness you perceive, higher awareness and spirituality. Next slide. So if we go from those centers and we expand out, we get these energy lines called meridians. And I want to say most traditional healing practices that existed for thousands of years start with this energy system. They didn't divide the body up at all. This was the holistic map that they had. So starting with these energy centers and chakras and then moving out. Here are these lines of energy. And these flow, they're named by the organs that they flow through, but they flow a lot of different patterns throughout the body. These lines actually follow the embryological development of the body as well. These lines have specific, you can touch into them with a needle or a finger pressure in traditional Chinese medicine with acupuncture, acupressure, and have a goal of a certain physical effect. But there's a lot of other, it's a holistic therapy. So it can interact with the emotions. It interacts with thoughts and beliefs. So anywhere that the body is stuck, you can utilize these energy levels to basically remove that stuckness, which is a lot of the disease models in Eastern medicine is about energy getting stuck. Where's your energy? What's your energy map? What can we do to move that energy? And we talk about this energy anatomy because this is where a lot of the levels of the integrative therapies work. And then moving on, we'll talk about the next slide. Sorry, the outer body. So our energy field comes out. It's not just in with us, in us. And this is where a lot of the healing presence matches up, So I may be feeling something inside, but it's affecting all of my energy levels. And so if someone steps into my energy bubble, they are going to, if they're sensitive and in tune, they may start feeling what's going on in my energy bubble. So different levels here, if you touch this surface of your skin, that's what we call the physical aura, expanding out into the etheric, emotional, mental, spiritual. Someone who has a really healthy spiritual life, that energy bubble can extend feet outside their body. If someone is in shock, what happens is a lot of these energy levels collapse in. It's almost like in a state of circulatory shock. The body kind of shuts down, the blood shuts to the heart and the brain to preserve, your physical being. In emotional shock, same thing happens with our energy level. That bubble gets smaller and collapses in. So just important point to realize what we're working with when we meet somebody's bubble, that we've got energy levels there.
Yeah. Well, and this also relates to presence, right? Like koshas, our aura, have an impact on other people. So
they really do. I alluded to this before, but in ancient times, they didn't really have ways to measure this. Now we have lots of different tests. You don't have to accept this information or energy anatomy map on faith alone. You can feel it. A lot of times what we do in class is we have people feel their energy field, feel your hands coming together and then allow them to come apart and start to feel the heat and warmth that vibrates between them. Okay, you're starting to get a sense of an energy field. This is also something working over the body, scanning that body and being able to feel the differences, the heat, the cold, Sometimes, a little bit of vibration, it can tell you about the body. We also have skin conductance tests, and they've used these to map the meridians of the body, and even the different acupoints as well. And then we have what was called a superconducting quantum interference device, which is this chamber that's basically isolated. When you do that, you can eliminate other electromagnetic fields, so you can actually detect the electromagnetic field of the body, and you can actually determine how big somebody's energy bubble is in one of these chambers. So there's lots of different ways that we know that these fields exist. And these are the fields in which we are working with integrative therapies. And we'll go into a little bit more, just some basic review of some integrative therapies and how we can influence this energy body and energy map. One of the easiest things to do for some people, I think if you've never meditated before, it might be actually a little bit of a more difficult practice. But being able to sit quietly, and a lot of times when we can go into meditation and focus the mind, we really do get a sense of what's going on inside of our own bodies. And that awareness is that first tool to starting to move the energy. There's roots of meditation in almost every ancient culture. It's about cultivating intentional focus, especially in the beginning as you're learning the process, and then just minimizing the distractions around you and distractions in our own life. If it was from the past or the future, be it just really becoming present. And again, talking about this healing presence, this is a good tool. The most types of meditation emphasize a couple of different principles: doing it in a quiet setting, finding a comfortable position, although you don't necessarily have to do that. There's walking meditations that you can do, trying to focus your attention on the present and coming in with an open mind. And I'd just like to, go ahead, Holly, sorry.
I was just agreeing with you. And just a reminder, I think, as we go through these points of different techniques and tools, they're meant to be for you first, and then there's something that you can, utilize for patients and clients. So this is part of self-care. This is part of the bigger picture of presence as well.
And I'll share a little bit about meditation, but I also want to let you know there's lots of tools out there. There's many apps that have meditation. There's one out there that's free called Insight Timer that I give to my patients all the time, that have just quick meditations, way to focus the mind. I love mindfulness-based stress reduction classes. They focus on meditation. They incorporate different types of meditation, and they've made a real impact in people's lives. And speaking of which, this is a study that looked at mindfulness-based stress reduction classes. So it's typically a class that's taught for 8 weekly for a total of 8 weeks with breast cancer survivors. And so the impact of that, they looked at objective measures. So noted a group that was receiving standard care versus this was pre-mindfulness-based stress reduction and post-mindfulness. So this was one group, and they were measuring before and after. This was, and they looked at measures of cortisol and interleukin-6, which are markers of inflammation. And they found an objective decrease of those inflammatory markers before and after participation in the mindfulness-based stress reduction. In addition to that, they looked at subjective states. So feelings of depression, anxiety, pain, what were their sleep patterns and their emotional well-being. And they also found a greater reduction post as compared to before they started the mindfulness-based stress reduction. So again, just the power of meditation to actually bring our bodies into a healing state, reducing those inflammatory markers and improving well-being. This is a study that was very exciting, came out just a few years ago, looking at the comparison of a common antidepressant, escitalopram, versus mindfulness-based stress reduction. So two different groups. One group took the medication, one group did the mindfulness-based stress reduction. Pretty good number of sample, 208 patients. What I found really interesting is that about 8% of the people dropped out of the escitalopram group, but nobody dropped out of the meditation group. At 6 months, they found similar efficacy between the medication and the people that went through mindfulness-based stress reduction. So to me, again, this is a way that integrative therapies shine. This is a non-pharmacologic intervention demonstrating similar efficacy for people that don't want to take medications. There's still options out there for them that are just as effective. So
Yeah, going back to that option giver, being an option giver.
yeah, many different options with that. So another thing that you can bring to your patients is breathing techniques. This is also great for anxiety. It's probably where I probably use it the most for people that are very anxious. They've got their sympathetic system in overdrive. We need to bring them back in to balance that nervous system, get that parasympathetic a little bit more active. And a breathing technique is called the 4-7-8 breath. And this is really simple. You just breathe into 4 counts, hold for 7 counts, and exhale for 8 counts. And I'll just allow you to be able to experience that. I'll have you sit comfortably and just take an inhale for 2, 3, 4, hold 2, 3, 4, 5, 6, 7, exhale 2, 3, 4, 5, 6, 7, 8. And you will do that in 4 cycles. Anytime you feel stressed during the day, anytime you're feeling overwhelmed, it's accessible, it's there, it's easily teachable. And again, we're shifting back from that sympathetic, we're toning that vagal nerve down, and we're getting in a state where we can be more present and more relaxed. So
You're the one that taught me this particular breathing technique, and I use it all the time for myself and my clients. So it's very accessible, very easy to use, love it. And it does exactly what you said it will do. So
wonderful. Moving on to mind-body therapies. There's many types of movement therapies. I love these therapies. Yoga, Tai Chi, Qigong. These are all based in ancient medical traditions. So, here, a lot of times Western medicine, we have pills and we have surgery. They had whole systems. They had touch therapies. They had movement therapies. They had nutrition. Nutrition was the base of everything, and herbal remedies. And these were ingrained into supporting the body, helping the body to heal. So just a little bit about yoga. Many different studies have been done. There's studies to support decreasing inflammation, decreasing pain, decreasing anxiety, decreasing depression, and decreasing stress and trauma. So people that have had traumatic memories, getting them into a regular exercise program that incorporates yoga is a very, very powerful tool. This is something I know hospital, it's a little bit hard to implement, although you can do some creative things. I love to open up presentations, doing a few yoga stretches, but just know that this is a tool, a recommendation that you can give to individuals that is a holistic therapy, integrative therapy. Tai Chi, Qigong, these roots are in traditional Chinese medicine. I should say yoga is part of the Ayurvedic system from India. But Tai Chi and Qigong have been studied, particularly in elderly individuals, but it's great for everybody, in decreasing falls and improving the balance, strength, and coordination. Also improving quality of life, focus and concentration. So for individuals that have ADD or ADHD, this is a wonderful tool. Decreasing pain, any sort of pain condition, and also improving function. And just provided some research articles if you need those to review about the beauty of this therapy. Touch therapies, again, most healing traditions have some incorporation of a touch therapy. There's many different current branches of ways that you can study and learn about touch therapies. Healing touch is actually its own individual discipline, integrative tool. Reiki is from the Japanese tradition, hands-on healing modality. Acupressure, which is one that I gravitate towards as an acupressure therapist. Holly is a cranial sacral therapist, also utilizing touch. And we know what happens with touch. Immediately touch, you establish a connection with someone, and a non-threatening touch as well. And that is so important, particularly our patients. Some of our patients have what I call medical trauma. They've been through a lot of, uncomfortable procedures which involved cutting of tissue, pain. The body remembers all of that. So it's really important to come with someone that they're balancing this touch with something that's very healing. And we know that touch can release oxytocin, which is a binding hormone. And that in itself provides comfort, but it also provides that connection with individuals as well. And I would say beyond that, it establishes this relationship of trust. I will just tell a brief story. I trained nurses how to do acupressure in the hospital. And I had a nurse that was working with a patient, and she's like, I don't think we're getting his field balanced. I want you to come in to kind of take a look at this. And so I said, I'd be happy to. So I went with her, and, the nurse introduced me, and the patient said, I don't want to be offended, but I really want this nurse to do the touch. And the nurse was like, well, wait a minute, this is my teacher. This is the person who taught me. But I immediately said, no, that's okay. I'm going to watch you do the touch. This relationship, this trust had already been established. It didn't matter what my credentials were. It didn't matter of me being the teacher. This patient wanted this nurse. That was the bond. That was the trust. And I was not going to break that. So there was always that therapeutic relationship right there. And that's how powerful these touch therapies are. And we know, we have studies, they decrease pain, they decrease anxiety, and they can help improve a variety of symptoms.
Yes. Real quick on the touch therapies, I just want to bring up, as people are here because they're interested in this for themselves, and also how does this apply to me as a nurse? I really feel strongly, you're already seeing it in lots of places, but that there's going to be a need for more and more nurses who have these skills, because they're going to be utilized in hospitals, they're going to be utilized in clinics. And if this is your passion and this is what you love to do, like, getting the skills now will just line you up for that moment when these jobs become posted and available. I just really have that vision, and I really believe in this. that part of it, and that's why part of why we have this academy is to prepare nurses for that need. Do you agree, Liz? What are your thoughts on that?
Absolutely. And, it's interesting. In one of the programs in Oregon, I had a dedicated group of nurses that we just decided to roll it into our practice. We were not given protected time in our schedules. And what happened was the program grew, but not because we were going and meeting with administrations. It was the patients that we were treating and writing letters to administration.
Yeah.
And they were telling about their experiences.
Yeah.
So, I think that this is a very patient and provider-centered therapies.
Yeah.
And it is important to bring healing back into medicine.
Yeah, I totally agree.
All right. And I'm just going to share a little bit because this is one of my passions is acupressure. We'll do a little bit of acupressure before we finish today. I love it. It's grounded in traditional Chinese medicine. It works with those meridians that we talked about and saw the pictures of earlier. We're using finger pressure. We're not using needles. So it's great for people that are needle phobic. It's easy to learn. You don't need any extra equipment, and it's really effective treatment for a lot of symptoms.
And real quick, this is one of the classes Liz teaches for the academy, which we'll talk about in a little bit, but she's an excellent teacher and it's such a great tool to have. So
I'm going to teach you just a little bit of protocol. I wanted to give you a little background about how this was created. 5 points in 5 minutes, so 5 acupressure points. This actually came at a request through a hospital pain management committee, and they wanted some acupoints to treat specific diagnoses. So they gave me a list of the top 10 pain diagnoses, and then or pain or other symptoms, and then we composed these quick protocols for treatment of that specific diagnosis. So the one I wanted to share with you is really looking at both stress and anxiety. One thing I found is when someone's in acute pain, their stress and anxiety levels are also up as well. If we can get those anxiety levels down, then the pain levels tend to come down as well. So just starting, if you look at this picture here, if you want to follow along with this protocol, if you were doing this with a patient, you would be doing both hands, but when you're working on yourself, it's completely acceptable just to do one hand. So if you find your hand, go down to the wrist crease, and you're on the outside of that wrist underneath the little finger, and you press into this. This is heart 7. And this is the balance point of the heart meridian. So just immediately bringing that heart into balance. And just hold this for about a minute. Our next point is going to be at the wrist crease. And if you can measure with 3 fingers and go to just above those fingers, aim just for right in the middle of that forearm. This is pericardium 6. And this is a good point for nausea, but it's also a good point for anxiousness as well. Good. Now we're going to come to the tops of our shoulders. So if you just imagine a line from your earlobes coming down to the tops of your shoulders, sits on top of your trapezius muscle. And then I just want you to press down on that point till you feel something pressing back up. This is gallbladder 21. And we nickname this one excess baggage because this is where we carry the baggage of our life, is on our shoulders. So by pressing into this point, we're just giving an opportunity to release those burdens. Okay, wonderful. The next point is the crown point. The easy way to find this, if you stick your thumb in your ear and then just go aim for the top of your head, middle of the head. It's right when you think of babies, that posterior fontanelle, that's where you're going to press the point. And very light pressure on this. This is actually opening that higher chakra on the brain, higher consciousness. And the final point, if you come down to your foot between your big toe and your second toe, and you go down to the inner webbing and follow that back until you hit a tendon, this is liver 3. And just hold that point for about a moment. This is a grounding point for that energy. Okay, there you did it. 5 points, 5 minutes.
Feel good. Feeling good.
Yeah.
Is there anything else you want to say before we?
No, just I would challenge people if they want to try it quickly every day and just see what effect that has on their body.
Yeah, super cool protocol, super easy. Kind of leads us into what's next. So first of all, thank you for joining us for this presentation. We hope you really liked it. This is just a quick intro, truly a quick intro. We have a full day class we can give you on these topics. And we narrowed it down to just over an hour. But this is a sample of what holistic nursing is and what we teach at the Academy, including Liz's acupressure course for nurses, which is a 2-day course. You do get 12 CNE credits or contact hours. And it's been very well received by those who've taken it. They love it. Something very easy to apply at bedside. Work on your families with. It can benefit you. It can benefit your families, and and when you get to that point, you can also bring it into your patient work. So what's next? We have other classes available that we're working on, and we would love for you to join us in your education and your journey to becoming, whether it's becoming a board certified holistic nurse or just maybe you don't need that and you don't want to do that. You can also just take these classes for yourself and use them in whatever capacity you want. But just on our website, theholisticnurseacademy.com, there's options for what we have available. You can get on our waiting list by clicking on join the wait list. And from there, you'll get an email when those classes open up and when we have openings for them. And so what's really important is that you make sure our emails go to your primary email, not your junk email, which is typical when you're getting these type of emails. So just watch out for us, get us on your email list, and we'll be sending you more information that way. Feel free to reach out to us individually. There's a way to click on the link that says chat option on the website. Feel free to chat with us. And I think from there, we can just ask you to also spread the word. We are building our community. We are building awareness around what our offerings are. We can start introducing more classes, more offerings as we get more interest. So we have lots of things that are in the works. As part of like building our community and having like maybe monthly or quarterly classes just to connect. So first things first is just getting connected with us and then going from there. We would love to have you here and joining us. But I personally am just passionate about helping and mentoring people. So if you just have questions, I'd love to help out that way. Anything else before we sign off, Liz?
I was also going to say you have a wonderful massage course for nurses.
Yep.
You have approved at this point in time.
Yep.
And we are in the process of looking at more offerings as well.
Yeah, so if you have a specific topic you would like covered and you're interested in, we'd love to hear about it. We'd love to hear if you're interested on online or in person. With the touch modalities, we're really wanting to give people an opportunity to have in-person training, but we know logistically sometimes online is more practical. That does affect how we approach getting our CNE approval. They're separate. Doing online and doing in-person are separate requests. So we'd love to get your input so we can support you and meet your needs. And again, we're just grateful that you showed up, that you came, that you watched, and we hope that you find this information valuable. And most importantly, we just thank you as a nurse, as a provider, for what you're doing for the world, for your patients, for your families. We know the work you do is super hard. It's super emotional. It's draining. It is physically draining. So just whatever you're doing, we're grateful for it. And we hope you have a great day, and hopefully we'll see you soon.
Thank you.
Thank you.